Hi, I'm Brian Clark from Yale University. On behalf of my co-authors, I'm happy to have the chance to discuss our study to be published in the February issue of Gastroenterology titled Quantification of Adequate Bowel Preparation for Screening or Surveillance Colonoscopy in Men. Determining whether a patient's prep quality is adequate for screening or surveillance colonoscopy is one of the most common and important decisions made by a gastroenterologist each day. To enhance the cost-effective delivery of this preventative procedure, multi-society guidelines have been developed to assist the endoscopist in determining how long each patient can go before their next exam. This depends on the number, size, and type of polyps removed, the patient's personal and family history, and importantly, the quality of the bowel prep. There's no question that patients with solid stool throughout the colon don't allow for an adequate view and require a repeat exam. On the other hand, it's obvious that patients with no stool or debris allow for an adequate view and don't require any shortening of the surveillance interval. However, the cleanliness of the colon is really a spectrum, and it's quite clear that there's great uncertainty as to what to do with the significant percentage of patients that fall somewhere in the middle. So the real question in clinical practice, and the question that our study sought to answer, is how clean is clean enough? What does it really mean to have an adequate view? The currently accepted definition of adequate prep is the ability to see polyps greater than 5 millimeters, but there are no previous studies that have actually determined when this occurs. So the aim of our study was to define the level of prep quality at which missing neoplastic polyps greater than 5 millimeters was not unacceptably increased, and therefore define what it means to have an adequate view, using a quantitative, validated, and reproducible scoring method, the Boston Bowel Preparation Scale, or BBPS. Now, it's not possible to randomize patients to different levels of prep quality, so we performed a prospective observational study to determine the rates of missing polyps depending on the level of prep quality. All patients underwent 2 colonoscopic examinations, during which the quality of prep was rated using the BBPS, which scores each of the 3 colon segments, right, transverse, and left colon, from 0 to 3, 0 being the least clean and 3 being the most clean. The first exam was carried out by one of 4 study endoscopists, and all polyps that were seen were removed as would be done for normal standard of care. The second exam was carried out within 60 days by a different study endoscopist who was blinded to the findings from the first exam. And again, any polyps that were seen were removed. An important part of our study design is that only colon segments that achieved a BBPS score of 3, the best possible score, on the second exam were included. So essentially we were evaluating the frequency of missing polyps for each of 3 BBPS segment scores, 1, 2, and 3, compared to if the prep quality had been as clean as can be, which is a BBPS of 3. We also adjusted for factors that could have influenced our results, including the patient's age, indication, colon segment, the total number of polyps removed on the first exam, and the endoscopist performing the procedure. 438 patients completed both exams within the 60 days and allowed us to analyze over 1,100 colon segments. We found that a segment score of 2 was as good as a segment score of 3, the cleanest score for finding adenomas greater than 5 millimeters, and was therefore adequate. On the other hand, a segment score of 1 resulted in a significantly higher rate of missing adenomas greater than 5 millimeters compared to segment scores of 2 or 3, and was therefore inadequate. This suggests that patients that have all colon segment scores, BBPS 2 or 3, have an adequate view and should return at standard guideline recommended intervals. These results have the potential to improve the value of colon cancer screening by standardizing the definition of adequate prep. Thank you for your time and interest.